Hi, Lisa Pelkey here, coming to you from my office in Bangor at Penobscot Healing Arts Center, where we treat Lyme disease and associated co-infections. And I am your virtual Lyme literate provider. Today I wanted to talk to you about a couple of things that are cutting edge, so biohacking and nutrigenomics. I don't know if you've ever heard these words before, but biohacking is essentially taking control of your health, which is what I try to assist my patients in doing. Because, I can only prescribe certain medications and advise them, but truly they need to take responsibility for their own health. And so part of that is utilizing, there's a new area of scientific study called nutrigenomics, which is utilizing nutrients or phytochemicals to try to biohack or alter essentially our genetic expression and upregulate our genes so that our bodies can perform better and we can be healthier. So I'm so excited because I recently saw on a new published study that just came out by Dr. Zhang and his colleagues. This was published in Frontiers on Medicine, and it looked at essential oils and many different essential oils and their effects on persistent forms of Borrelia. So, as you may know, one of the challenges to chronic Lyme treatment is that antibiotics will kill the live forms of the spirochetes. However, they are unable to penetrate biofilms, which are essentially like, if you think about an M&M, and a biofilm is something that the bacterium creates around it in a little colony, and it's just like the hard outer shell on the M&M. And then inside, the spirochetes congeal and cluster, and the antibiotics are unable to penetrate this biofilm. So essentially, Dr. Zhang found out that there are certain essential oils that will penetrate these biofilms in vitro and in vivo. They found that the stationary forms had certain essential oils had activity against these, and the top three that they found were oregano, cinnamon bark, and clove bud, which actually cinnamon bark and clove bud are combined in a protective blend that has been formulated by a company that I prefer that uses therapeutic grade pure essential oils. So anyway, in this study, it was shown that at a low concentration, 0.25%, there was significant anti-persister activity. And it was shown that the essential oils were actually more active against persister forms than the drug daptomycin, which Dr. Richard Horowitz recently did a study on and found that this particular antibiotic did have some activity. However, further studies are needed to find out how long to treat and so forth. So this is still somewhat experimental. So it was found that carvacrol in oregano was the most active ingredient, and so obviously further studies are needed to determine the safety and pharmacokinetic properties of these essential oils and in what concentration to use them before they can be considered as a novel treatment for Lyme disease. But this is certainly very hopeful and something that certainly could potentially be incorporated into your Lyme therapy. I am giving a talk tonight at Bagel's Central Meeting House in downtown Bangor at 6 p.m. If you'd like to hear more about biohacking and nutrigenomics and something very exciting called NRF2 activation, which I've talked about before, and I'll actually do a video on in the near future. So hopefully you can join me tonight, and if you found any benefit from this video, please share the video, and I'll see you soon. Take care. Bye.